Let's speak now to the Care Minister. That's Gillian Keegan. Very good morning to you. Thank you for your time this morning. I wonder if I could first get your immediate reaction to those phrases: a tsunami of unmet need and an exhausted and depleted workforce.
Well, if I could give my immediate reaction, which is the first time I've been on your show as Care Minister, and I just want to say a massive, massive thank you to the 1.5 million people who work in social care, who have done the most fantastic job all the way through the pandemic and continue to do so. Now, as I mentioned, that's a massive workforce. It's actually even bigger than the NHS, 1.5 million people. And it always has struggled. It does struggle because we have growing needs every year because we have more ageing people and the demographic challenges. So, you know, for many years, this has been a workforce that's under incredible pressure. But of course, that is intensified at this time, particularly as we have 1.1 million vacancies. There's a lot of competition for labour. So it is a worry. And that's why we've announced this £162.5 million today, which is there to effectively retain and to build extra capacity and also to bring in thousands of new people as well as employ agency workers.
OK, so you've said thank you to those workers, which I don't doubt. And in the same breath, you've talked about this figure of 162.5 million workforce. And this money, the 162.5 million, is to retain 1.5 million workers. Other people have already done the maths. Have you presumably done the maths yourself? It works out, I think, £108 per care worker. That's what that sum represents. So what difference is that going to make?
That's not the metric we use. What we're looking to do is to get more hours in the system, many millions of more hours in the system. And that's done by either agency workers, in terms of retain, there's a lot of capacity in the workforce as well. So we've done this before. We did it in the pandemic. It paid for things like childcare so that somebody could work some extra hours, give more flexibility in those individual decisions, as well as agency workers, as well as recruiting new workers. So it isn't just dividing it all amongst 1.5 million people. Clearly, that's not going to be the right approach. So it's there to retain and grow capacity.
So if I understand this correctly, faced with the Care Quality Commission report talking about an exhausted and depleted workforce, you're saying work more hours?
No, only if people can. No, not at all. We're saying...
You did just say that.
Well, we did this before during the pandemic, and some people chose to work more hours if they had, for example, contribution to childcare costs. That did work before. We're not telling people to work more hours at all, but we did see there was some spare capacity in the system for people if we help them with additional costs. So that's one option. Of course, agency staff is another option, and recruiting and training new staff is another option.
You're talking about spare capacity. I thought the CQC report detailed at great length that is precisely what there is an absence of.
We're talking different levels. I'm talking about an individual who may be able to make an individual choice, as they did previously. You're talking about the overall system capacity of the 1.5 million people, of the vacancy rates in the system. They're two different things. The vacancy rates in the system is a worry. They're always high. As I said, there's a continual churn in the industry. One of the reasons we've grasped the mettle of trying to tackle social care, and we've introduced this new tax which starts in national insurance levy that starts in March next year, is because of this issue. This issue is much more strategic. It needs a long-term fix, but obviously in the short term we can't put all of those things in place. It needs professionalisation, it needs investment. The workforce, there's many issues with the workforce. There's 40% churn. There's many overuse of 0 hours contracts. There's a lot of issues with the workforce, and they need to be professionalised. There needs to be better career progression. They need to be valued more, and that's the long-term fix. But between now and March, all we can do is provide extra money into the system, and we can try to grow that capacity as much as possible in
Gillian
that
Keegan,
short term.
can I ask you a question? Is a care worker a skilled worker?
Absolutely.
So You have now, if unless I'm misunderstanding something, you have just reclassified care workers into a category in which you could employ people from the EU. That puts them into a special category of people who can come and work here.
No, what you've just done is used a word in the English language and tried to say it's reclassifying. Skill is, you asked me, are they skilled workers? They are skilled workers.
You know,
they're highly valued
that
and
is
skilled
an
workers.
official.
If you
My
asked me the
apologies, Gillian
question,
Keegan.
if you asked me the question, Charlie, are they, under the definition of our immigration system, skilled workers, I would have answered the question, no. There are social care managers who are on that list, but social care workers are not on the open immigration list. And we've been very clear about this. Every time we have shortages, we do have shortages. We've got 1.1 million vacancies across many sectors right now. What we've said very clearly is we are not rushing to pull that lever of immigration, which actually I don't think it would work anyway, because many people don't want to be moving around in large numbers at the moment. But actually, it's not the right thing to do. We need to invest in our people here. We need to build the professionalism here. We need to invest in their training, and we need to ensure they get the right terms and conditions. So, yes, they're very skilled workers, highly skilled, in fact, akin to nurses in many cases, if you look at what they actually carry out. But if you ask me, are they on that definition for the immigration list, the answer to that is no.
A short time ago, we spoke to Chief Executive of an organisation called Brunel Care, work in the southwest. Such is the problem they're facing at the moment. They have empty beds, so beds that would be available, but they don't have the staff. So they can't use the beds that could be used for people who need it. There's something really wrong about that.
There's lots of pressures in the southwest in particular for labour. Those shortages, I hear them about every single sector, but it's very acute in the southwest because there's less young people, the demographics are different, obviously it's large and rural, and that is a challenge. We do also have some under-occupancy actually, which is there for a reason and has actually been funded by the government just to help them with COVID patients and managing specific settings so that we help make sure that we keep infections lower as well. But there's no doubt in the southwest there are severe shortages of labour, and everybody's competing for the same labour. So that is absolutely true.
I'm mindful
and I know
of,
that there's a number of actions that the local authorities there are looking at to improve the situation.
I'm mindful of time here, so we can get through a couple of things very quickly. Just one issue on care workers. Is it acceptable for a care worker to be paid minimum wage? Is that wrong?
No, we have minimum wage there for a reason, national living wage as well. But of course,
So that's okay, is it? That is okay.
We are not here as the government to set wages or prices. That's not what we do. We are here as a government to make sure that we support the sector. But the sector is a private sector. We do not set their salaries and conditions, which, by the way, there is a huge range of, as well as a huge range of use of things like zero-hours contracts.
Two things I'd like to get through with you, so as quick as we can, if possible. Is the government reassessing the issue of mandatory mask wearing? Is that a conversation that's happening? Has anything changed?
No, nothing's changed. We had the Plan A, Plan B. We laid those both down. 14th of September, we announced those. We said we start with Plan A. Plan B is there, of course. But the big, and what we need to talk about is how we make Plan A successful. And there's a couple of things there. The first is making sure that we get everybody to get a booster jab as soon as possible. The young people and children 12 to 15, we've opened up the national booking system today, so they can go on if they haven't had their jab at school and use the half term to get a walk-in or GP surgery, etc. And also to urge the 4.7 million people in this country who are eligible, who haven't had a vaccine, to please come forward. It is the most important thing we can do to protect everybody, to make sure we keep this wall of defence, which has broken the link between case rates and death rates. But we need everybody to play their part, please.
OK, and if I may, one last question. On the booster jabs, there is a story in some of the newspapers today that 6-month timeline between your second vaccination and the booster jab, the government is now considering bringing that to 5 months. Is that true?
The JCVI are the people who make that decision. The advice they've given us so far is 6 months, but of course they're looking at data every day. But the decision will come from the advice will come from the JCVI. So obviously our job is, if they do change to 5 months, and they have changed over time, the distance between jabs. But if they do, we as the government will just be ready to act on that.
Gillian Keegan, thank you very much for your time this morning. Gillian Keegan
Thank
is
you.
the Care Minister speaking to us this morning.